Pediatrics is the branch of medicine that involves the care of infants, children, and adolescents. And for English-speaking families living in a minority situation, well, finding services that meet your children's needs can be a bit of a challenge. So if you live in the Stanstead or the Magog areas of Quebec and are looking for pediatric services, stick around for today's episode. Beautiful, dynamic, accessible, those are just a few of the words that people use to describe Quebec's eastern townships. And in this web series, we introduce you to and we help you learn more about the organizations, the services, and the topics that are important to English speakers living in this fantastic part of the province. So welcome to About Townshippers. Le TANDEM is a bilingual community social pediatric center that offers services in Magog and Stanstead. And their approach is very inclusive, very holistic, and they take into account the physical, the emotional, the mental, and the society-related aspects of children. Now, this approach really facilitates early screening of children that may be experiencing situations of vulnerability, situations that can affect their health, their development, and their integration at school. Jade Desrosiers is a clinical nurse at Le TANDEM, and she's with us today to talk about their unique services and how English-speaking families can take advantage of them. Here we go. Well, good morning, Jade, and welcome to About Townshippers.
Good morning, Ed.
Hey, Jade, we're familiar with the term of pediatrics, and we know it's really the mental and health care of infants and children and teenagers and adolescents, but social pediatrics is a term that I wasn't all that familiar with. So what's the difference between pediatrics and social pediatrics?
Yes, well, in fact, social pediatrics is like a new term since the past years. It is like a integrated social medicine approach around the Fondation of the Dr. Julien. So it's really like centered on the needs, interests, and fundamental rights of the children, as well as their family. So it's really a holistic approach in which we are integrated. So we also have like a multidisciplinary team. So on the social, psychosocial, as well as the medical approach. So we have, for example, family doctors, pediatrician, psychoeducators. We have different zoo therapists for the children. So it's really we have all of these services at the same place to offer to the child and their family. So it's really for the children to reach their full potential that we call in all the aspects, like the physical health aspects of their needs. And it's really also an importance of communicating with the partnerships in the community as well. For example, with the family doctors, with the daycare, with the schools. So we can all have the approach around the child. And at the TANDEM directly, for example, in Magog and Stanstead, like our four main values are, we have the child's right, the hospitality, the empowerment, so that the families can have the empowerment on their, the process of having the capacities of children and families in implementing their solutions, and the accessibility. So that are our four main values at the TANDEM.
Values. It's really interesting. What listening to it, what the expression that comes to mind is, it takes a community to raise a child, or it takes a village. And that's really what that's like.
So that's really the social pediatric approach, which is different from the pediatrics, for example, at the hospital, which is maybe less implementing all those services around, like, for example, the community around the child. So
that's less holistic.
Yeah, exactly.
Okay. Now, you mentioned Stanstead. So the TANDEM has been offering services in Stanstead since 2020, but you've been well established in Magog for quite a while. Now, how do the services in Stanstead differ from the services that you guys offer in Magog?
Services in Stanstead have been there since January 2020. And what is actually, we are the same team that offers services both in Magog and Stanstead. So we're the same team that go to Stanstead. And what is different, we have had some difficulties in Stanstead, for example, to have some family doctors to go there. So what is nice as well as having a clinical nurse at the TANDEM is that if they have a family doctor, for example, well, I can do the meeting that we call evaluation orientation, which is where we have the psychosocial and the medical approach, like a meeting with the family and their child to like have a plan of action for the child and to meet their needs, for example. So that's nice. As well, what differs is, for example, the different groups that we can offer. For sure, we offer many different groups in Magog, and in Stanstead, we are starting to build up more groups, but we have to, you know, since we're the same professionals that work in both places, well, sometimes it can be a little bit more difficult on that aspect. Considering the fact that we have 58 children in Stanstead that have services at the TANDEM, and that we have a lot more. We have actually 185 children in Magog, which makes a total of 243 children in both sites.
With different needs, with different
yes.
backgrounds, and so you guys are busy.
Yes, pretty busy.
Okay. Now, each year, the Tandem offers a program that helps children and their families kind of prepare for that back to school period, or that transition. So tell us a bit about that.
Yes, this is in fact it's the 4th edition for the Sunnyside School this year, and the 3rd edition for the Jardin des Frontières, which are the 2 elementary schools in Stanstead. And this is a camp that really has been proven to work for children, and the schools are also very excited about that. It is, for example, 5 half days during the summer. So it will be coming up in August, at the end of August, just right before the entry of schools. And that we go 5 half days in one school and then 5 half days in the other school. So Jardin des Frontières and Sunnyside. All our team participates to this event. For example, we have the psychoeducator, the occupational therapist. I will be there. All our members can participate. And there are different activities in which children participate. And at the end, we can kind of have a screening of the different needs of the children. And so that's really, we know that it's important to have the screening the earliest possible for all of their spheres in terms of health care.
So when you say, Jade, when you say screening, you mean when you get the profile of the child's needs? Is that what you mean? Or
yes,
okay.
What we call the dépistage in French,
okay.
Like the screening of, for example, all of their health and well-being. And this year we also have added a parents workshop every morning of the camp, the 4 different mornings. We have 4 different workshops that can be topics around that can be really important for the parents at this state of age for their child. For example, like on the Monday, it will be the parent-child school relationships. So discussing the importance of that. On the Tuesday, it will be, for example, on the healthy lifestyle habits. So that will be animated by me, like around different lunches that are healthy, and so around that. And then there will be helping with autonomy skills. So how to for the child to gain more autonomy. This is like the kind of period that it's important. And there will be like the occupational therapist as well that will have, how to choose your backpack, how to use your pencil, things like that. So that will be very interesting to have to test out this year.
The last day is a pretty special day, isn't it?
Yes, exactly. It's kind of a celebration. So we have the children do like a healthy snack, which is like a fruit salad. and we invite as well their family, and we invite also all the partnerships of the Stanstead community. For example, we invite the Cuisine Collective, we invite the mayor, we invite like the Imagine Stanstead, which is like workshops through literacy in action. We also invite like the Phelps Helps, which is like the community-based tutoring program. The pre-program that we call, which is Perseverance, like educational success, and the Humphrey Magog relay resource. So the families can see like all the help that they can have right there in their community.
I'm sure if you looked into the dictionary, under the word community, we'd probably see a picture of le tandem. That's a really neat, very inclusive, like you said, holistic approach. The camp that we just talked about is unfortunately full for this year. Is that correct?
Yes, it is full. Yes.
So yes. People may be wondering why we're talking about it. If it's full, well, at least they'll know that that's a service that exists, and that they want to get in early for next year. For families, whether they're in Magog or whether in Stanstead, English-speaking families, that if they think that they could benefit from the services that you guys offer, what's the process that they should go through to, or they can go through to, get a hold of you and to access your services?
Yes, well, that is actually in one of our values, the accessibility. So we have 3 different modes that they can come to our services. For example, if they can either call or come by at the Tandem directly. Then they can either be referred, for example, by teachers in school, family doctors, a neighbor, family. And the other mode of to access our services is, for example, through different screening activities. So the dépistage, for example, in the language stimulation group that we offer, or for example, the kindergarten camp that we just spoke about. So those are the 3 different modes that they can access our services. After that, when the families, either if they call or they decide to come by, we kind of go through a pre-assessment, different questions a bit to understand the vulnerability criteria that we have. So for example, families that can afford services in private areas are not necessarily pediatric families. So they have to have, for example, for sure, different financial difficulties. They can have physical and health and well-being difficulties. So different kind of risk factors as well that we evaluate. So for example, children in needs of Tandem services can be, for example, if they have developmental delays, for example, if they have emotional difficulties, living with anxiety, depression, things like that, or having learning disabilities. In Magog, for example, we offer as well the help with the devoir, with the
homework. Oh, a complete menu, right? That's a lot of stuff that you guys offer, and that's really good because it's not just a yes or no. You can access our services as a process. It's a very it seems to be a very inclusive approach.
Yes, and exactly. And when we do the pre-assessment, we also evaluate kind of what are their needs and what can we do to help them. And what's also very important at that moment is that we speak with the partnerships. For example, the CLS, if the CLSC is implicated, or if the Youth Protection Center is implicated as well, we will speak with them to make sure that we do not duplicate the services and that we really offer services that they need. And if, for example, we see that they have a lot of services already, then we can just try and refer them to them to make sure that the process is done that way.
In Stanstead, is it safe to assume that more of the services are offered in English?
Yes, pretty much all the services are offered in English, since we know that that's the principal language for the families in Stanstead.
Well, Jade Desrosiers, you're a clinical nurse at the Community Social Pediatrics Center, Le Tandem, and you guys have a center in well, the main center is in Magog, but you offer services in Stanstead as well. You've been really kind to take some time to talk to us today about this really neat, or these neat programs that you guys offer. Well, great. Well, thanks for taking the time.
Have a nice day.
You too. Take care. If you'd like to contact the team at Le Tandem and learn how you or someone you know could benefit from their services, well, all the information is right down here in the video description, or perhaps it's up there. Anyway, either there or here. Now, if you found this video useful, please share and like, because it really helps us spread the news and the information throughout our English-speaking communities. And you can also subscribe to Townshippers Association's YouTube channel, which is, of course, where you can find the other 50 or so episodes of this web series. Thanks a lot for spending a bit of your time with us today. My name is Ed Humphrey. This is About Townshippers, and we'll see you next time.